Alright friends, in today's PowerPoint we're going to be discussing advanced directives. My name is Allison, and let's get going. For objectives in this topic, we're going to be discussing advanced directives, and the pre-hospital care providers will be able to determine whether or not to provide resuscitation efforts per protocol to a simulated patient based on an advanced directive. The team is going to pursue CRM on scene by demonstrating closed-loop communication during a given simulated emergency. In this PowerPoint, we're going to be covering do not resuscitate orders and the My Post agreement. We are going to be talking about associated CHEMS protocols that come with these orders. The purpose of a DNR is to provide pre-hospital care providers in accommodating patients who have do not resuscitate orders because they may not benefit from CPR or do not wish to receive CPR. It is an order to facilitate kind, humane, and compassionate services for patients who have executed this order. A do not resuscitate order is applicable to all pre-hospital life support agencies and personnel. A do not resuscitate order may be executed by an individual 18 years of older, of sound mind, or an individual 18 years in age of older that may depend on spiritual means through prayer alone for healing, or an advocate that has an individual of 18 years or older that may not benefit from CPR efforts. In order to follow a DNR order, like I mentioned, the patient has to be 18 years or older and have no signs of vitals. This includes no pulse, no evidence of respirations. The patient is going to be wearing a do not resuscitate identification bracelet or necklace, and this is clearly imprinted with the patient's name, phone number, and the declarant's attending physician information, including their phone number as well. The patient also may be hand carrying a wallet-sized do not resuscitate order, as you can see right here. And this is going to be travel sized. They may also be carrying the actual large paper sized version as well. A patient that does display vital signs should be followed with normal protocols. They will receive all treatments, all medications, and you will not deny them any form of care. A patient with an incomplete do not resuscitate order form should be considered full resuscitative measures, and CPR should be initiated while med control is contacted for direction. In the event that care has been initiated on a patient and a family presents a valid do not resuscitate order or a form is identified, please discontinue resuscitation and contact medical control. The declarant or the patient advocate may revoke the order if it shows that at any time the person can communicate this intent and they are of sound mind to make this decision. Resuscitation efforts shall be initiated, and you should contact medical control to advise them of these circumstances. Similar to any patient contact, a PCR should specify the circumstances that the patient's conditions were found, and the EMS should describe the do not resuscitate documents involved. You should also document any delays in care, any complications, or contact your supervisor with any additional questions. You can identify a DNR patient with their bracelet, necklace, or anything that has do not resuscitate clearly written. Paperwork can be in homes. Typically, they are on a fridge or in frequently used areas. Nursing facilities can have these DNR orders on face sheets that they hand out to the providers on ALS and BLS arrivals. A My Post agreement is similar, and we'll discuss that later, but that is going to be a pink sheet unless it is a digital copy. A DPOA may be also in possession of this paperwork, seeing if a patient has been discharged from the hospital recently, or discharged from a nursing home, they may not have this paperwork with them. You should consider basic measures to be taken until hospital, med control, or the paperwork proves the patient's DNR or full resuscitation measures. Cards can be located in patients' wallets or purses. Please feel free to check if you have any questions and a patient is not able to advocate for themselves. This is an example of a DNR sheet. CHEMS has this on their website. You can feel free to pull up the Do Not Resuscitate protocol, and this will give you some indications of some additional information on this topic. And you're going to have the declarant signature, an advocate that is going to be making decisions for this patient in their time of need. These decisions are based on religious beliefs or personal beliefs that prevent them from receiving certain types of treatments that they do not wish to have should they become not able to advocate for themselves. You should have 2 attending physicians sign these orders, and they should be considered valid across any state line as long as the patient has this documentation to support their status. Secondly, we're going to be talking about the MyPost agreement. This is the Michigan Physicians Orders for Scope of Treatment. This is a relatively newer procedure, so this is kind of allowing the patient to make their own medical decisions, and it's a guideline for pre-hospital care providers so that they can have directions to accommodate patients who do not wish to receive or may not benefit from certain interventions. These patients have advanced illnesses or medical conditions that, despite curative therapies, compromises their ability to continue on and carry a high standard of living. Death is imminent within the next year or so. The patient must have their MyPost agreement renewed on a yearly basis, and often a provider can agree over the phone to give a 72-hour extension to a MyPost agreement, but this 12 months is very strict. So if a patient does not have these agreements dated within the past year, should consider this patient full resuscitative measures. Conditions that may allow a patient to have a MyPost agreement are terminal illnesses with no cures. This can include various types of cancers, heart disease such as congestive heart failure, respiratory problems like COPD, kidney disorders or kidney failures, liver diseases, and chronic infections. The MyPost goal is to help people with medical conditions who can have a conversation with their provider about treatment options available to them and what that will mean. Like I mentioned, this population is likely to experience a medical emergency in the next 12 months that will require life-saving interventions. This is different from a Do Not Resuscitate order, as this patient has a valid reason to have these orders. A Do Not Resuscitate order is in case the patient is ever not able to express their wishes. The form is voluntary, and the patient may revoke it at any time. The patient can revoke their orders if they can communicate their wishes. A DPOA can consider treatments that are consistent with the patient's wishes should they have to make that decision, and it's not outlined in this agreement. And an attending healthcare professional can adjust the MyPost agreement or revoke it should the patient's condition change or it adjusts their life expectancy. This form is going to be pink in color and outlined as a pink, but normally the whole sheet's going to be pink, and the digital copy may not follow suit. The patient is able to specify cardiopulmonary resuscitation, so they can choose attempt resuscitation or do not attempt resuscitation. This is considered a DNR order. The patient can allow comfort-based treatments, and this is similar to hospice care, and the patient should receive full palliative treatment for pain, trouble breathing, bleeding, or other medical conditions, including any medication by route to the applicable protocols. Relief of choking caused by a foreign body is appropriate, but if the breathing has stopped and the patient is unconscious, ventilation should not be assisted. Follow the appropriate transport and destination protocols as needed. Selective treatment for the patient is going to be allowing them to be receiving IV fluids, cardiac treatments such as cardioversion and non-invasive airway support. All patients receive comfort treatment when they do not allow invasive airways, and they allow cardiac monitoring and medications. The patient also has the opportunity to select full treatment, and full treatment allows all patients to receive Comfort Plus. A full treatment should be provided. This includes, but not limited to, intubation, invasive airways, and mechanical ventilation. If no boxes are checked, full treatment is implied. In conclusion, advanced directives are a legal document that is intended for all adults 18 years or older, and it is to tell others who want to make medical decisions for you if you cannot communicate, to tell others what medical treatments you would want, your values, and what you care about. A My Post agreement is a medical order that follows you across all care settings, and anyone, regardless of age, that is seriously ill or frail may receive this order and have it executed should the situation need for it. Feel free to discuss on your shift, or if you have any additional questions, seek out your closest instructor coordinator or find me. Alrighty, have a great day.